Back to work here in our third segment of our four-part segment in Unit 2, Digestive Diseases in Animals. In this particular section, we're going to talk about displaced abomasum, BVD, bovine viral diarrhea, colic, and swine edema before we finish out with our last set. Displaced abomasum, again, unique to ruminants and especially to dairy cattle, where you have the abomasum, the fourth compartment of the stomach, four-compartment stomach, and the ruminant is displaced or moves either to the left or right side of the animal and kind of floats up by the near the midline of the animal on near the backbone on the left and right side, kind of gets out of place. Oftentimes associated with dairy cattle early in lactation, let's say within the first 60 days after calving, when they're somewhat stressed and trying to catch up to how much they can eat. Oftentimes associated with some other metabolic or health problem, like they've had milk fever or ketosis or acidosis that we just talked about. You can have a number of associated problems that come with that. Even respiratory problems I've seen cause an animal to DA. Often includes a torsion. And what I say by torsion, and especially that's somewhat more common with an RDA, or right side displaced abomasum, is where you'll see the stomach and the intestine, especially the abomasum, twist. Think of a garden hose that you twist in half, and therefore the blood flow stops, which is really an unfortunate and really bad effect of displaced abomasum and causes animals to really have trouble recovering because you tend to get loss of blood flow and then obviously infection and loss of tissue begins to set in. Oftentimes caused by a number of different things, whether it's low fiber, very high carbohydrate diets, low rumen pH situations like we just talked about in acidosis. Maybe the folks that are out mixing feed made a distinct error and mixed a lot more grain or a lot less forage than they're supposed to. And then the associated problems that I just listed on the last slide. Clinical signs, you'll see they'll drop off of their appetite really, really rapidly. And if you don't catch them really quickly, they lose a lot of weight just within the first few hours to few days. And you'll see kind of a Gantt appearance to them. They'll have a normal body temperature. This is one of those things that does not cause an elevated temperature. If there is a body temperature associated with this, it's because they've got another problem also bothering them. The DA generally doesn't cause a problem. Detection is done with a stethoscope. So get your stethoscope just like your doctor at the doctor's office and thump or flick the left side or right side of the animal. I've added a video on to this section that I'd like for you to go and watch, which is you'll see the detection of a DA and also them carrying out a DA surgery right there on the farm. But you'll hear a distinct ping that's the gas reverberating whenever you thump the animal on the side just lightly with a flicking action of your fingers. Treatment generally requires surgery, the left or right side. So you basically make an incision right ahead of the hip bone, right anterior of that, go in, remove the gas out of the abomasum, and then tack it down to the body wall. That will generally keep that from happening again. The right side ones, the surgery success is much, much lower. Those tend to be associated with other very difficult problems, and so some veterinarians are very leery of right side DA surgeries. There is also a method called roll and toggle, where you actually roll the animal upside down and then use the gas that's in the abomasum to help bring that abomasum back to its proper position, and then you basically just stick a needle with some suture right through and catch the bottom of that abomasum and suture it to the belly. And I've seen veterinarians that do that, and they're very, very talented at that. It's much less invasive, and the ones that are good at it, their success rates are equal of that of those that do surgery. But obviously you have a little bit less cleanliness there in that situation, and so sometimes you get some other associated problems that come with that. So anytime you're doing a DA surgery, you're probably going to take an animal in and put them on antibiotics for an extended period of time to make sure they heal from that any associated surgical infections and whatnot. Next is bovine viral diarrhea, or BVD, a very, very acute and contagious problem that's present across the United States, and it's spread really readily by contact. And we're talking about contact animal to animal, animal to vectors, which we're talking about varmints on the farm, traffic, whether that's footwear from people that are visiting on your operation, your veterinarian, your feed sales professional, or even those that just drive in on their vehicle. If they track through manure that's BVD contaminated and then come onto your farm, there's a chance that they may carry that with them. This one carries a pretty significant high fever, and oftentimes with some respiratory discharge going on with it as well. What's unique about BVD is you'll find some mouth lesions, some sores develop inside the mouth. They develop really rapid and a lot of really bad diarrhea. And if you get animals that are pregnant, let's say 60 days or more, out all the way to the 7th month, they'll actually can cause abortion. What is really scary about this one is during the first trimester, they're probably likely to abort, and you may not even know that they were pregnant, or you may not even have realized that BVD caused the abortion. The second trimester, the fetus may survive, but maybe with incomplete development of organs. And so the calf may be born dead or something like that, or stillborn. The third trimester, you can have a number of different things. The scariest of which is the calf shows a mild infection, but doesn't really respond to treatment, and they actually see that disease within them as normal. Those are called persistently infectors, or PIs, and so they recognize that virus inside them, inside the calf, as normal, and so they shed the virus readily, never really show symptoms, and really those are the ones that spread that disease everywhere. It's like, think of it as you're carrying the flu virus but don't know it, and you come to school and you shed that flu virus and shake hands with everyone and have that problem really reverberate through the classroom. That's what a PI calf would do. Chronic BVD then can occur in herds really persistent and subclinical. It could be a number of different things going on. They kind of have 2 to 6 month cycles where they have periods of diarrhea and up to about 10% death loss rates. It's really a problematic disease. Prevention, you can vaccinate for these. If you use a modified live, which is an MLV, make sure that you don't use that on pregnant cows, or you can use a killed vaccine. Either way works just fine. Your veterinarian can help you guide on which one is most effective. Treatment, you've got to go with antibiotics. Keep them hydrated, and then these are probably animals that you should consider for culling. As you move through your management decisions. If they're shedding BVD virus throughout your herd, you got to worry about whether they're healthy to keep in the herd. Next section is talking about colic here. Again, acute digestive disease, really severe abdominal pain, and oftentimes associated with them just finishing up a heavy exercise and they suck a lot of wind. Maybe you've got some bad quality grain, too much grain, the wrong kind of hay, coarse hay, too fine a hay, change in environment, parasites. There's a number of different things that can cause just trailering a horse and hauling it to a show or a trail ride. You can have a number of different things that set in and cause colic in horses. So the list is rather brief there. As we get to how the horse feels, is they'll cramp. They'll have sometimes a twisted intestine. If you get a horse that rolls, that's maybe kicking up their stomach and begins to roll, then you can have what we call twisted intestine associated with colic. They can have what they call intussusception, which is the intestine telescopes inside itself. That's really a problem for horses. So oftentimes you got to keep that gut moving, and it's best to, especially early on, if you anticipate that they're struggling with some colic, keep them walking. That walking will help pass the gas. Horses do not belch, so any gas that they have built up in the digestive capacity, digestive area, has to go out the rear end of the horse, has to exit via the rectum. Clinical signs, they'll do a number of different things. They'll lie down, they'll sweat, they'll roll, they'll paw, probably have high respiration, high pulse rates, probably don't eat very well, and they probably don't have any bowel movements because you have some clogging going on in there. So preventative controls here, don't make sudden feed changes. Again, you'll find that's best management practice throughout a lot of different things. Keep them regularly exercised, lots of good water, the right kind of hay, not too coarse, not too fine. Free choice salt, deworm on a regular basis, and then treatment things, walk the horse regularly. If you keep on hand some pain medication, that's maybe a good idea to administer. And most of the time, you're going to need to call the vet unless you're pretty experienced in handling a colicky horse. But really keep them from lying down or rolling. Never let them roll, because you'll have intestinal problems that develop along with that. Surgery obviously is always something to consider. But obviously that's quite expensive, so your vet will look at a number of other ways to alleviate the gas if necessary, use of laxatives and so forth. So consult with your veterinarian if you've got a horse that is prone to colic. Last one, I believe, in this part 3 of a 4-part series is swine edema disease. And so as we turn our attention to the non-ruminant for once, usually we're dealing with swine edema in a young pig, 4 to 14 weeks of age. And you'll see it confused with a number of other diseases, and primarily we think about scours, which is another one that we'll be talking about in part 4. Caused by E. coli in the intestine, they'll colonize. Oftentimes E. coli is associated with really high carbohydrate feeding, and you'll get the wrong kind of E. coli population to colonize and proliferate in the gut, and it stresses that animal out, or if you find an associated stress, it'll cause swine edema to kick in. And so you'll have pigs that are doing very, very well, and all of a sudden just kind of flop over dead. And you'll see, like I have listed here, it's oftentimes associated with some other stress. You may or may not see a fever develop. You may or may not see some wobbly gait or them back off a feed. Oftentimes you'll just kind of walk into the barn and find them dead. If you're dealing with a short time period, they may recover within a couple days. If it's heavy onset, they're probably going to die very quickly. Dramatic symptoms are listed there in apparent blindness. They'll bang into things, tremors and convulsions. You'll see a lot of different things. But you'll see edema and swelling in the head area, the eyelids. And if you did a post-mortem exam on them, you'd actually see edema or swelling, collection of fluid in the stomach area. And so then finally, if we look at prevention here, there's no vaccine. This is not a virus related problem. It's a proliferation of the wrong kind of bacteria in the gut. So just do what you can to reduce stress. Historically, swine producers have fed antibiotics in order to help keep those bacteria in control. And treatment is sometimes not very successful. And so again, if you're anticipating some kind of sudden change, a different feed, a different environment, maybe moving pigs from one location to the other, it might be wise to work with your veterinarian, work with your feed nutrition professional, prescribe some antibiotic therapy in order to get those pigs on a healthy plane before you make any changes to their environment, to their gut, castration, whatever. So that's going to conclude part 3 of our 4-part series here in Unit 2.